Hi Bio4 and welcome to part 3 of blood vessels. We have a lot of vessels in this picture here, and I'm just going to highlight a few, but with more detail in future slides. So as you can see in this diagram, lots of different arteries. We're not going to learn the name of all of these, but I do want you to know some, especially here in this area of the thorax, and then here abdominal. So let's take a closer look. So in the major arteries of the trunk, you're going to notice that there was the aorta, so the aortic arch. We've been talking about the heart a lot. So this is the aortic arch, and this is a thoracic aorta, and it's going to become the abdominal aorta. And just think of it as one big major hose that is irrigating all these different organs with oxygenated blood. So we need to learn the names of some of those. So let's look up here. And I think the next slide is clear. So if we have the aortic arch here, notice that we have three major vessels that are coming off that arch. Okay? And let's follow them a little bit. So if you follow up here, you'll see that one's coming up on the right side of the neck, and the other's coming up on the left side of the neck, but this is a branching that's going on here, and then one that's going just to the left arm all on its own. So this is the complication when we think of arteries here. The complication is that it is not symmetrical. You know, I want one to come exactly like this one. I want it on the other side. And it's not like that. So that can be a little confusing. So let's start from this end. And here they're labeled, but that's for just sort of quiz purposes. For right now, I have one major artery here. Let's start as we read from left to right. Let's go in that direction. As we start here, we think of this artery, and let's think of where it's going. You know, part of it is going to the arm, part of it is going to the head. So if I have an artery that is going to branch like a river and half go one way and half go the other, I can name it depending on where it's going. So the name for this one is brachio, because it's coming to the arm, cephalic, because it's coming to the head. So this section here only, labeled number 2 here, would be the brachiocephalic artery, which is going to change its name after it branches. Because after that, here, it's going to be one that goes under the clavicle. So I'm going to call it subclavian. So this region here is subclavian. And this region that's going up to the head is the right carotid artery. So this would be right and left carotid arteries. Okay, so down here, I have brachiocephalic. Here I have carotid. And then this one is going under the clavicle here is subclavian. That again is going to change its name when it gets here to the region of the axilla. So there I'm going to call it axillary. So let's do those again backwards. Axillary, subclavian, and then brachiocephalic. And then aortic arch. Okay, this one, number 2 here, if we're thinking of the 3 that branch off the aortic arch, this one is coming up the side of the neck. It is the left common carotid. Okay, that leaves us a third. This third here, I want to call it just like this, but I cannot, because there is no section of it that is going to go both to the arm and to the neck. This little one here does, but still that's not enough. We really refer to the larger carotid. So here it goes under the clavicle, and if it goes under the clavicle, then I'm going to call this region subclavian. All of this subclavian until it gets to the region here of the axilla, and it's going to be axillary, and then it's going to get to the region of the arm, and it's going to be brachial. Okay, let's do it backwards. Brachial, axillary, and subclavian. And there you have it. You have all of them. If I backtrack one, you have them here labeled, maybe not super clear, but you'll be able to see what's going on with the names on it for you to study. Okay, moving on, we're going to come down now to the abdominal region. And in the abdominal region, again, we're going to learn only the major arteries, and I have erased the ones that I don't need you to know and left the ones that you do need to know. So we tend to learn them in order, right? From, if this is where we're transitioning from thorax to abdomen, this first one that you encounter, notice it has 3 branches, and that's the celiac trunk. Celiac trunk. Then as I come further down, the next one that comes pretty soon after the celiac trunk is one that's going to irrigate the mesentery. If it irrigates the mesentery of the small intestine, it's going to be called the superior mesenteric because it goes to the small intestine. As I travel down, and I'm coming still the abdominal aorta, there's going to be the renal and renal on the right, renal on the left. Both of those come after the superior mesenteric. And as we come down, these smaller ones are gonadal. So the gonadal arteries are those that are either going to the ovary, or they're going to the testicle. Next would be the inferior. This one branching off here is another large one. It's called the inferior mesenteric because it is going to the mesentery of the large intestine. It's really called the mesocolon, but think of it that way. It's kind of like the mesentery of the large intestine. And so that's the inferior mesenteric as opposed to the superior mesenteric. As I keep coming down, I'm going to branch now because I have 2 legs. And on either side, I'm going to have a common iliac, because think of the bone that's there, your iliac bone. You have the common iliac, and then one that's going to go deep down, a branch of that, and that goes very internal. It's going to be an internally directed. So that's the internal iliac, and this region here would be external iliac. Common, internal, and external iliac on both sides. Common, internal, and external iliac. Let's do them backwards. External iliac, internal iliac, common iliac. We come up, here we have inferior mesenteric, gonadal, another gonadal, a renal, another renal, a superior mesenteric, and a celiac trunk. Okay. You will have to draw these later, so that's going to help you remember them. Let's stop this and we will continue on our next video on the capillaries. Thanks for listening.